So, yes, Zurab, coming to you, and we have one more question. Clinical exposure is one of the biggest concerns for Indian parents. So, how does Geomedi University ensure students receive a quality clinical training?
Question, I just want to add something to your previous question. Okay, so why they choose the Geomedi University, right? So I would add also that we have very quality education. Okay, for example, okay, so lectures are in larger group, but when we have the practical classes, okay, so we have very small groups. Okay, 15 students per group. Okay, so and students get chance to ask the questions. Okay, and then we have discussions, and then everybody has the chance to get involved into discussion and understand the much like hard, like the difficult topics during discussion section. Okay, so the other thing is in terms of the clinical exposure. So like I mentioned, starting from the third year, after they finish these basic subjects and then they start the clinical subjects. So all subjects are taught at clinical setting. Okay, so we have our clinic, so which is for only Geomedi students. No other university students has access to that clinic. Only Geomedi students can go there. And we have several other clinics we're collaborating with. And every single clinical subject in our curriculum, okay, so is taught in clinical settings. And before they go to the clinics, like I mentioned, we have very good simulation center. Okay, so first they start practicing on the mannequins, and then when they're good on the mannequins, and then they're starting clinical subjects, so they go into the hospitals, and then they get real experience. Okay, from real clinical environment.
And how experienced the professors and the faculty members in the Geomedi University?
Our faculty members are very high profile. So I will repeat that most of our faculty members have at least some experience from Western countries. So I mentioned in the context of the language, but it's not only language, right? Western experience in the Western countries is the high standards. Okay, European countries, in US. I personally have done my postdoctoral research in US at Penn State University. So therefore, I would say that we have very high profile faculty members. So we keep high standards, okay? So the Geomedi University has quality education, I would say. That's the most important things we have.